Well, again, the governor mentioned $8 billion structural imbalance. Over $8 billion in one-time revenue that was used to balance the previous budget. Significant decisions that had been put off not only in that 2-year period, but oftentimes for years in some of the key state programs. So the governor just sat down and said, we need to develop some broad principles, we need to think about what is the best way to take this on, and again, what are the public policy choices to make? And we sat down and did that. The budget was a means to an end, not an end in and of itself. And the end was provide for economic growth. So let's look at everything that we do in putting this budget together as a lens to enhance Ohio as a place where people want to do business. We've got to control our costs. We've got to deliver that predictability and stability. And so we did that. Needed to eliminate that structural imbalance, which we did over the 2-year period of time. Our ongoing revenues and our ongoing expenditures are in balance in the second year of this biennial budget. And on our budget plan, we're right on mark. Revenues coming in above the estimate so far. We wanted to review all spending. Not just general revenue spending, but spending in the non-general revenue funding counts as well. The idea being that we have to think about how does Ohio take in revenue, how do we allocate it so we can protect those important priorities. State's aid for schools, state foundation support for schools, increased. State foundation support for our institutions of higher education, increased. Need to reform and restructure state government. Medicaid, prisons, our economic development operation with the creation of Jobs Ohio, and it means to fund Jobs Ohio. And I know we'll hear more about that as the afternoon goes on. And then lastly, preserve the social safety net. Let us make sure that the services for the most vulnerable are adequately funded. And again, careful time and attention was given to that, and I think as the governor said out of the box, people said, how can this possibly be done to balance this budget without raising taxes and without tremendously harming the state's support for these important social service programs. It was accomplished because of the governor's willingness to take on some of these hard questions, carefully review all spending, which is what we did to get this budget in balance.
Let me say that first of all, I went to see the Nutcracker on Saturday night, and there was a great conductor of the orchestra. Tim Keene ended up sitting right in the row right behind us. We couldn't believe it. You can be a conductor, but if you don't have the people to play the music, it doesn't amount to anything. Tim Keene, invaluable in this process. And don't forget, we have about $250 million in the rainy day fund, and we're running an overage right now in the budget, which is called for in the statute, and we are running ahead of revenues. We're not going to pound our chest too hard, because this national economy, Europe, and what happens in Washington, who knows about next week. But for now, we feel pretty good, and we've been given the credit of an increased credit outlook, which sends a message across the country. One of the other things that was important is you just don't crush people that can easily be ignored, and we'll get to, and don't let me leave here without having John Martin and Tracy Plouk say something about mental health and developmental disabilities. We were not going to run over people, just not in our nature. Greg Moody, whose wife happens to be a preacher, didn't know whether he wanted to come to the administration. His wife said, you have a heart for it and you're going. The Medicaid reforms have now become something that the entire country is looking to copy. I don't need to tell you about the political fight over the ability to have mom and dad stay at home rather than go to a nursing home. 1/5 of the cost of being at home, where you're more independent, healthier, happier, instead of being put in a nursing home, while preserving the need for nursing homes because they're necessary. But they shouldn't be used when they don't need to be used. And you talk to your mother and father, your grandparents, they'll all tell you, God, if I could just stay at home. This was something that had been worked on for 30 years. I don't know how many more studies, reports. Didn't take another study or another report. It just took a little determination. we were able to get that done. It would have been easy to save some money, wouldn't it, Greg, to have denied children dental coverage? Well, that's an easy one. Just cut off their dental coverage. Well, where does that get you? So we decided to take a look at the 4 or 5% of the 5% of the Medicaid population and be able to get them over time in a setting where they're going to be more comfortable. You know, it's sort of similar to the medical home that Dr. Winslow is a pioneer of. Manage them so they get better quality care. They should not get their primary care in an emergency room. And Greg put together an incredible program, including the integration of mental and physical health, another controversial item. And we have now been able, well, Greg's being praised by those in that community because of the sensitivity. Praised by the AARP for his home and community health philosophy. Praised by the mental health advocates, am I right, Tracy, for the integration of mental and physical care. And that is where we are today. But I want you to understand that Greg is heading into Medicaid 2.0. And Medicaid 2.0 is the ability to be able to drive the dollars of Medicaid with private sector improvements. This is one of the to-dos that we will get into a little bit later. But we just, for example, we're down with General Electric, which is an awesome company here in the state of Ohio. And we are going to align our Medicaid dollars with the reformers in Cincinnati to drive outcome-based medicine, not quantity-based medicine, where you get as many in there and you charge them by the unit, as opposed to paying people on the basis of outcomes. This is where we want to go. This is where we want our families to be. We want to pay physicians, healthcare providers to keep us healthy, not get them to be paid on the basis of how many sick people they treat. This is a transformation of the system. And Greg Moody is he's the author, and he has a great team along with John McCarthy, who moved his family here from Washington, D.C. I don't see McCarthy. Is he here today? There. He's a great man, brilliant man. And Greg, stand up and say a few things about what you were able to achieve. Be shorter than the governor, though. He goes on too much.
Well, I appreciate the personal comments, but of course, you know, we all did this together, not just our team, but also with the legislature and with stakeholders. We were in this interesting situation where we had this natural coalition where what consumers said they wanted and greater stewardship of taxpayer dollars were actually the same thing. Being able to be cared for in a home and community-based setting instead of an institution is what people wanted, and it's less expensive. The challenge was to providers, because really we said we can't do it this way anymore, we have to do it a different way. And that was challenging to folks. Hospital providers, physician providers, folks really stepped up and said, we get this as a bad budget, we get that we just can't cut our way out of this, let's work together to figure out where we're going for the future. And that combination, consumers and taxpayer interests challenging providers, and honestly challenging us to do better with our government systems, that was the combination that made it really an obvious choice politically for the legislature and for us. Like the governor said, we're just getting started. We had to focus first on Medicaid modernization, but we're already starting to look at how to streamline other health and human services, basically get our house in order to do better, share services, and then really align our purchasing power with the private sector so we have aligned expectations for improved health outcomes.